But if you look at all comers with this biliary atresia, what you'll find is about a third of them will do extremely well. They won't need anything else. Their bile will be able to be drained, and they will come back down to normal bilirubin levels and normal levels of their other liver functions. About a third of the patients will then teeter along, do well in the beginning, but then scar down some, and eventually they won't do very well. Their liver will actually become irreversibly scarred. Then a third of them won't do well at all. No matter what you do, you cannot get enough bile to come through, and their liver will then progress to being scarred, irreversibly scarred. So about two-thirds of them will then require a liver transplant at some time.
Is that very difficult to get a liver source for a kid like that?
It is, because liver sources are used for size as well as availability. So some places you can actually divide up a liver and give lobes, but some sources you wait for a transfer, you get on a list. But in the end, it really depends on how much you weigh. And so it's an age and a weight issue. And obviously the younger you are, the harder it is for you to physically place a piece of liver into you. So there is some time frame here that you have to wait. And it depends, again, on how sick you are, where you are in the list. So in the end, if you think about biliary atresia, about a third of the patients do well and two-thirds don't. The middle third of those two-thirds will teeter along for a while. So in the end, what do we have here? We have the most important thing, and that is recognition of the symptoms, doing the workup, which involves, again, the symptoms are clay-colored stools, bilirubin, itching, signs of liver failure. Then we do an ultrasound. We do a HIDA scan to look to see if there's a conduit. We then do some blood work, right? And then we do a liver biopsy. And if the child does have these symptoms, they should undergo this Kasai operation, which the official name is a portohepaticojejunostomy, which means that we put a piece of intestine up into the liver to drain it, and then reconnect the intestine downstream to make a continuity.